Hi, I'm Dr. Sunil Richardson. I'm a maxillofacial and a craniofacial surgeon. I'm practicing out of South India, very close to the southernmost tip of India. Today we have a patient with a very interesting and challenging condition. It's called hemangioma or a cavernous hemangioma in his case. It's a very large lesion though. We're going to go and show you the lesion. But before that, a little bit about the background. So he comes from neighboring Indian country, from the country of Bangladesh. He has been to India several times before. आप इसके पहले कितनी बार आए थे यहाँ पे इंडिया को?
यहाँ पे 3 times.
3 बार आए थे. So he's been here 3 times. और ये तीनों बार आपको ये सर्जरी ट्रीटमेंट के लिए आए थे. और क्या किया था तब आपको?
इंजेक्शन दिया.
सिर्फ इंजेक्शन दिया था तीनों ही बार, सर्जरी नहीं कराया. और जब से आपको ट्रीटमेंट बांग्लादेश में हुआ अभी तक कितनी बार ट्रीटमेंट हुआ है? 10 बार कि 11 बार? 11 बार. So he's had 11 treatments till now in the last 12 or 15 years. 3 of them were in India and the remaining 12 were in his home country of Bangladesh. बांग्लादेश में ढाका में हुआ कि कहीं और में हुआ? In the capital city of Dhaka. Now he's come to us because we're going to do an excision for him. I'm not going to be injecting a sclerosing agent like what was done for him on the earlier numerous occasions. Yes, he has a pretty large hemangioma, but we're going to try and get that sorted for him for life. Okay, now we're going to show you how the lesion looks. So if you see the moment he leaves his lip loose, there is a mukulo. Look at that lip. It's all large lesions hanging out on both the sides, and it's extending inside up to this part on the left side. Okay, and I'm going to show you on the right side again, everywhere. Look at that, and it goes right into his upper jaw, back again into the lower jaw, and you can see the swelling here, swelling there. And he also has a significant facial asymmetry because of this, which also I'm going to try and address. All right. Then the next challenging thing is his tongue. Ji dikho. So he has a large lesion. Look at that. All the tongue is involved. Well, if I have to completely remove the hemangioma, I'll have to remove his tongue. So I'm not going to be doing that. I'm going to be removing the lesion in segments and retaining as much of the muscular part of the tongue below, beneath. And it's extending up to the base of the tongue. So I'll be able to get clearance, lip, cheek on both sides. All right, and we're also going to show you the scan now. Scan it. First up, I'm going to show you the scan report before we go with anything else. It says involving tongue, floor of the mouth, pharyngeal walls, paralaryngeal spaces and right side of the face. They haven't mentioned the lip if you see, but there is a large hemangioma on the lip as well. Okay, now we're going to show you the films. We did an MR angio because I want to be sure about the flow of the vessels, and if you see here, you can see the amount of vasculature he's got. So we're getting an idea about what are the vessels that feed the lesion, and depending on the size of the vessel and the location, I'm going to clamp these vessels, remove the lesion, and then proceed with the surgery. That's the plan. So we're going to be using some techniques of suturing and also some techniques of excision. You can see the places which are dense, the hyperdense areas, all areas involving hemangioma. So it's a very extensive lesion. There's no way on earth we can remove the entire lesion. You shouldn't remove the entire lesion because by doing that, the patient is going to have a severe deformity. Now, remember, he's a guy in his late teens, he's 19, and he's also seeking to have a normal life. So not only am I going to remove hemangioma, but not in its totality, but remove to the extent that he has as normal a lip as possible, as normal a tongue as possible, as symmetric a face as possible, as functionally normal as possible. So right now he has bleeding issues because of which he has difficulty chewing food for a long time. He's fearful from playing so many contact games or other issues, even fearful about having a normal life. And COVID has been kind to him because he says he wears some masks for a longer time. Some of my patients do tell me the benefit of wearing a mask is because you can have it concealed, but the functional aspect of it still stays with the patients. So he's a brave kid, and after having so many sets of treatments for so many years, he's come it again, and I hope this is going to be the last treatment for him, or at least we're going to make it so much as close to normal as possible. How are you feeling now? आपको कैसे लग रहा है? डर लग रहा है?
थोड़ा
क्यों डर लग रहा है? ऑपरेशन के पहले जानता नहीं हूँ, इसीलिए डर लग रहा है. डरने की बात नहीं है, ठीक है, हम देखेंगे, कुछ नहीं होगा. आप सो जाओगे एनेस्थीसिया में, उसके बाद जब आप उठेंगे तो मुंह में प्लास्टर लगेगा, टेंशन नहीं लेना, और फिर धीरे धीरे वो निकालेंगे. So what we're going to expect for him in the next couple of weeks is that after surgery there's going to be a lot of swelling. Usually I see patients with this kind of a large lesion, the swelling tends to be more for a couple of days, and after 48 hours gradually the swelling will come down. I'm going to keep him here with us for 7 to 10 days, and once the initial recovery is done, only then send him back to his home city and home country. Now during this time also he's going to be having some restrictions about food. As you can see, we're going to put him on liquid diet. Probably we're not going to give him anything today. We're going to be giving him parenteral nutrition today. That is, we're going to give him some IV fluids to start with and continue that as well. He's going to be in the ICU for a day or sometimes even longer. We'll try to show you his progress as time goes by, and then थोड़े महीनों के बाद फोटो भी भेजो, ठीक है ना? All right, so all the best, and we keep you updated on his progress. We're going to start his surgery in a short while from now, and it's going to take quite some time. Not able to clearly put an hour as to how long it might take, but anywhere around 4 hours is what I've got in mind, is what I think will take. We've also got blood ready, we've also got the team ready. We're going to give him hypotensive anesthesia, and yeah, thank you.